without further ado, if I could ask Lesley and Sarah to turn on your videos so we can have a little wave hello to everybody. Hi, Lesley. Hi, Sarah. So these are our two speakers. Lesley's going to go first, followed by Sarah. So I'm just going to introduce them, and then I'll put the spotlight on Lesley to screen share before she hands over to Sarah. So Lesley Foulkes is a neurovascular nurse specialist, and she's got extensive experience in supporting patients with neurovascular conditions, including cavernomas. And I have no doubt that we've probably got some of your patients on our chat today. She has a strong focus on providing holistic care, helping patients navigate both the clinical and the emotional challenges, because the two go hand in hand. Lesley is an active member of the Cavernoma Alliance UK Medical Advisory Board and has contributed significantly to the development of new resources, which will be going live in August. And she's going to be talking to us about managing the overlooked symptoms of cavernoma. And this is something we've put on actually in response to the number of queries we had into our helpline saying, often the focus is on hemorrhages and seizures. What about all the other symptoms? And we absolutely agreed. Then handing over to Sarah Wilkinson. So Sarah is a qualified and fully practicing neurological physiotherapist, and she's been doing that for 20 years. Sarah, you don't look old enough. Since 2011, she's worked with a private practice providing neurophysiotherapy both in clinic and within patients' own homes. Prior to her work in the private sector, she worked extensively in the NHS, both with acute and rehabilitation units and within the community. And she set up a company called Neurotherapy Worx in 2019, which offers neurological physiotherapy treatment for both paediatric and adult neurological conditions and injuries.
And thank you very much for inviting me to come along today. I was asked to talk about the overlooked symptoms of cavernoma, and I think there's a lot of overlooked symptoms generally with neurological conditions. I've just covered a few things, a few general ideas, and hopefully it will be helpful. So Cavernoma Alliance undertook a survey, which some of you may have taken part in last year, and a part of that asked for people to note their reported symptoms, and these are the symptoms that were listed. I'm going to cover some of them, not all of them, and the ones I'm going to cover are the ones that I think are probably more likely to be overlooked and then often harder to manage, I think. So overlooked, really, I think the reason that some things are overlooked is because they are not visible. Often people look very well. There's nothing to see on the outside. And that makes it harder for people to be aware or to understand or acknowledge that other people might have some symptoms or after effects of an event or something that are causing them some ongoing symptoms. And they're not always talked about as well, these sort of hidden and overlooked symptoms. They can often be hard to measure. I'm going to cover quite a bit about fatigue, because I think that's quite difficult to measure. How do you describe or measure how tired or how fatigued somebody is, and trying to describe it as well. It's not just about feeling sleepy at the end of the day. Sometimes these things are harder to manage. They can be harder to treat, and they're very individualized. And that makes them more difficult for people to understand. So that can be family, colleagues, friends, and healthcare professionals as well. And unfortunately, I think that sometimes these hidden and overlooked symptoms then get a little bit forgotten about because they are harder to deal with all round. So there's been a number of trials or surveys over the years looking at sort of unmet needs and of these sort of symptoms in a lot of neurological patients. There was a trial looking particularly at patients with subarachnoid hemorrhage, so a specific type of brain hemorrhage in 2020. And 80% of people felt that they had an unmet need of some sort. Most commonly, it was fatigue related, but it really highlighted the importance of the need for further research to aid sort of post-discharge and community support and services. And there was a big review of quantitative studies undertaken and reported in the BMJ in 2021 of patients following a stroke that found overall of more than 1,000 studies, the main concerns were sort of support with information and accurate information, physical function and mental health. And reported generally is that there's a chronic shortage of rehabilitation services and there's uneven access and uneven funding across the country. And so in some areas there are better provisions of services than others, unfortunately. And that has an impact on quality of life and will have an impact on increased pressure on other health services. So moving on just to some of those sort of more overlooked symptoms. And I'm starting with fatigue because I think in most neurovascular conditions, it seems to be one of the main ones. It's one of the big ones and underlies a lot of the other symptoms or can aggravate a lot of the other difficulties people have. So fatigue can be mental or physical. So you can, often mentally fatigue quite quickly. And physically, you might not have too much of a difficulty, or vice versa, or a combination of both. So, managing fatigue is really difficult. There's no magic, pill or medication. There's nothing that, often there's no specific cure. And it often does come down to managing lifestyle. Sometimes we try and sort of explain about when fatigue and sort of the brain's energy levels in when you've had any kind of neurovascular diagnosis or an event within the brain that it often has caused some degree of injury or damage. That means that if you think of your brain's energy levels like a phone battery, and when your phone gets a little bit older or it has been damaged, then your energy levels, your battery just doesn't hold charge for as long and needs recharging more regularly. And that I feel sometimes is, what it's like for people, that they need sort of more regular recharges. So, managing lifestyle, take regular breaks throughout the day. It doesn't have to be disappearing for, an hour or two for sleep. It could literally be 5 minutes, just a cognitive break, just to give your brain time just to clear itself of additional information, just to rest, just to recharge. Planning your days, planning your weeks, trying to avoid this kind of boom and bust. So feeling good, having a full battery of energy, doing as much as you possibly can, and then paying for it the next day and feeling worse, headachy, tired, sick, a number of symptoms. So, try and plan to do an even amount spread across the week. There will be times when you have to do more, when everybody has busy weekends or stressful events or things happening at work that you can't avoid. And it's just then thinking, okay, if you've got a family wedding at the weekend, maybe plan to, have quiet the Monday, Tuesday, or, don't have a busy day at work and then plan to go out in the evening. So just sort of planning things a little bit more and make other people aware of how fatigue affects you and what your limits are and what you can and can't do. And, start to be aware of how it affects you. Is it that you get headaches? Is it that your, speech becomes worse or you struggle to concentrate? And then you'll start to understand your own signs of when, you had enough and it's becoming too much. You will have bad days, and it is incredibly frustrating, the amount of people I talk to, and the fatigue is just incredibly frustrating. But I think the important thing is that this is often extremely common. Things fluctuate, and when you're having a bad day, your symptoms will generally be worse. You will feel worse, but try not to worry and panic that something's going wrong, because very often it can be related to fatigue. And looking after yourself, I think, eat well, keep really well hydrated, exercise, which you might think is opposite, if you're tired, but, having some exercise is good for building up your physical stamina, often is good for mental fatigue, helping to have a bit of a break from everything that is buzzing around in your head. And really good sleep hygiene, sleep routines, going to bed at a good hour. And not looking at screens just as you're going off to sleep. Headaches are the next one that I was really wanting to focus on, because again, a lot of people struggle with headaches and trying to manage headaches. And unfortunately, I think, whilst there's many factors that contribute to them, if you've got an underlying health condition, meaning that you're more prone to headaches, then there may not be a cure. And it may be trying to manage headaches to minimize them as much as possible. Again, fatigue, as I've mentioned, can be quite a big contributory factor, as can stress and anxiety. And stress can contribute to causing headaches, and can be caused by headaches. So the more headaches you have, the more you might worry, and the more you're stressed and worrying, the worse your headaches are. So a bit of a cycle. And medications. So, I think all of us and a lot of people I speak with have headaches and are on medications, or their GPs prescribe medications. And I think that if you're having regular chronic headaches, you need to review medication, what you're taking, because medication overuse is a very real issue and can become quite a problem. There's guidance on it in the NICE guidelines. So medications such as paracetamol, ibuprofen, codeine-based medications, if you take those for at least 15 days in a month, that will be enough to result in headache as a result of medication overuse. So you really need to be stopping medications, those sort of medications. And if you're having regular headaches, getting something that is more suited to long-term management of pain. And I think just remembering as well that, we all get headaches every now and then, migraines, and, some of the headaches that you're getting might be more day-to-day headaches that you would have experienced before, or that other people might experience. So things to try and help: keep a diary, keep a headache diary. What are the triggers? Is there any particular time of day that you're getting the headaches? Is there any activities that seem to make things worse? Is it, particularly linked to work or school, or when you've done certain activities? And that helps to work out, what the pattern is. Are there things that trigger it? How much is too much? And those sort of things can be really helpful in helping to manage the pain as well. Talking therapies help a lot with stress, anxiety, talking over the link between health conditions, physical health conditions and symptoms, and mental health difficulties. I've just put in there the link for the NICE guidance, which is about recommendations for the management of chronic headaches, which health professionals will use and be guided by. But it's quite useful to look at as well, because they give classification of particular headache patterns and symptoms, and the way headaches present to determine what sort of headache you're getting, which then will guide us to how best to manage it. And look at alternative therapies. So there is good evidence that acupuncture is actually really good for headache management. Acupuncture is very effective for some people, less so for others, but that's the same as most medications and treatments. They can be quite individualized. But acupuncture can be really useful. It is available on the NHS in some areas, but not in all areas. So it's something that you would need to access your own GP to see what would be available. And if you've tried in Southampton, I think it's as long as you've tried and not had success with 3 different types of analgesia or recommended chronic headache management, then referral to a local neurologist or headache clinic would be appropriate to get more specialist guidance. So putting dizziness, balance, ataxia, so problems with coordination and balance, because this is one of the areas that were reported in the survey that were done. And, the causes, having a cavernoma, having had a bleed from a cavernoma. People often report they have more difficulties when changing positions, so turning head quickly, first getting up in the morning or standing up, or bending forwards, gardening, doing things like yoga can be quite difficult. And really it's just allowing a bit of time for your brain to recenter and just readjust to the changing position. Overstimulation as well can make people feel a bit unsteady. So if you've got a lot of noise, a lot of a lot of people around, and everything's busy and a lot going on, your brain can become quite easily overstimulated. And if the brain becomes overstimulated, you can get feelings where you feel quite uncomfortable, a bit unsteady. Often people describe almost feeling a little bit uneasy, almost like a bit panicked and need to leave the situation. And medications, some pain relief, some of the stronger analgesics can make you feel lightheaded and dizzy, and some anticonvulsants also potentially have that side effect as well. So it might be worth just reviewing medications if it's an ongoing and regular symptom. And visual difficulties, so double vision or field loss, so you've lost an area of vision, particularly on the sides, that can affect your depth perception and that can affect balance as well. So give yourself time, regular rest breaks, try and avoid busy situations if these cause you difficulty. Review your medications. If it's ongoing, if there's really nothing in managing your lifestyle that is helping and it's particularly problematic, then you can be referred for vestibular rehabilitation, which is specialist physiotherapy to help with exactly these types of symptoms. And vision, I've mentioned it in the previous slide, but a lot of people do having had a neurological event or having got a Cavernoma, could have double vision, which is really difficult to live with and manage, because obviously it really impacts on your focus and say your ability to judge distances. Field loss, which can be some people can lose half of their field of vision, some people it's just a small amount, but again it will have an impact on daily life. And slow focus, so looking down from maybe sort of reading something to then looking at a distance, it might take a bit longer for your vision to focus, and it might just be a bit slower. And we often find that when people have had a new diagnosis or a new symptomatic event, that vision can be worse for a little while, or they might need to wear, previously we wore glasses every now and then for reading, need to wear them all the time. So significant visual difficulties would be referred to an ophthalmologist or an orthoptist who would look at movement of the eyes, or having regular sight tests. Opticians are really useful and a really good resource as well. So don't forget about the opticians. Speech difficulties. Some people's speech can be more slurred, or commonly a lot of people find word finding difficulty, just can't get the right words out, or names can often be difficult. So speech and language therapy can help. I think letting people around you know that you might have difficulty with your speech, you might be sounding a bit slurred. I have known of people who have slurring of their speech, or speech is a little bit more difficult to understand because of a neurological event, and they've been discriminated against because people have assumed that they're drunk. I know a gentleman who was not allowed to get on the bus because the driver thought he was drunk, but he had speech difficulties. So, letting people know. And tinnitus, again, is really common, and we don't really understand why. A referral to ENT can be helpful, but in many cases, there's no particular cure for it. If there's no specific underlying cause, of which the majority of tinnitus, there isn't anything that seems to be particularly identifiable, unfortunately. So memory, concentration, something that a lot of people will struggle with. And I know it was something that was reported on the survey again, and they're quite interlinked. Most people will have more difficulty with short-term memory rather than long-term memory. So new information, day-to-day events. And concentration is more difficult. Concentration takes quite a lot of mental energy. And particularly if there's distraction, if there's noise, if you're not really paying attention, it's really much harder to concentrate. If you're tired, it'll be harder to concentrate. And if you're not concentrating fully on something, you will struggle to remember it. If you don't concentrate on something, you're not going to retain that information for future recall. So they're very closely linked. And again, mental stimulation overload crowds, busy environments, lots of background noise can play a big part in that ability to concentrate, the ability to remember things. And as you're more tired later in the day, you know, if you're trying to concentrate on something particularly stressful or complicated, then mental fatigue will affect both of those factors too. Neuropsychology are incredibly helpful in coping strategies, assessing people's memory and concentration, identifying specific areas that might be more difficult in your individual case, so you can target particular tips or therapeutic measures to help. So neuropsychology is again a bit hit and miss depending on where you live, but there are neuropsychologists all over the country. Occupational therapy, again, really helpful resource. And occupational therapists will help a lot with how you can use some of those tips to help with memory and concentration, and how to put those into day-to-day life. And again, managing sort of day-to-day lifestyle and what you're doing in any given day, and how you manage sort of work situations in order to minimize the difficulties. And obviously, with all of those symptoms on top of having a diagnosis of any sort, you know, there are the psychological and the emotional impact. You know, a lot of anxiety, you know, will come and go. It's not surprising to feel a bit anxious. Mood might be low. Feelings of isolation, particularly when you have a diagnosis of something like Cavernoma, that is, you know, is not so common, is maybe less well understood generally in, you know, the population, in the community generally. Fluctuating mood. This again can be linked to when you're tired, you know, feeling a little bit more frustrated on occasions, having less patience, a bit emotional. And, you know, sometimes when, you know, all of those things factored together, that kind of filter that we have, that sometimes speaking without thinking, can become a bit more likely to occur, which can be difficult for the person themselves, but also difficult for family members, for colleagues, for teachers, for children as well. I think the important thing is try to access relevant and accurate information. Try to avoid just random Googling and going down rabbit holes of websites that maybe are less credible. So, you know, try and access information that is linked to reputable charities, or, you know, particular health authorities, or NHS, or, you know, actual hospital or approved research. Talking therapies. So within the NHS, you can self-refer for talking therapies. It's often called iTalk or Steps to Wellbeing. It is different around the country. Depending on which county you live in, it will be slightly different. But if you just Google talking therapies NHS, it will come up as to which one is most relevant. And then from there, you can access counselling, cognitive behavioural therapy, group therapies, one-to-one, depending on what your needs are. And then also accessing things like at school, like SENCOs, so the educational support workers as well. Family and friends, you know, support from family and friends, therapists that you might be involved with, nurse specialists, and really make use of those charities like Cavernoma Alliance, because they're such a valuable resource. And again, all of this will have an impact on your social and your, you know, the practical aspects of your life. And it you know, possible that it will reduce your ability to take part in work, education, hobbies. Driving may or may not be affected if you have no symptoms, or no sort of symptoms of a specific nature. Then driving is unlikely to be affected. If you do have symptoms, it's very individualized depending on what those symptoms are as to how that will affect driving. And that itself will have quite a big impact on independence and lifestyle, and being able to access work, for example. And then the financial impact that comes with it as well. Vocational rehab services are really good. They're specific services that usually run through occupational therapists, specifically designed for helping integrate people back into work, or helping people in the work situation with health conditions and how to manage work and sort of get the balance right. And occupational health teams that work with employers, again, to help make sure people are well supported and protected, and that there's a good balance between what you need and what the employer needs to keep you safe and supported. If you are unable to drive for medical reasons, so the DVLA has deemed that you're not fit to drive on medical grounds, then through a lot of councils, you can apply for a free bus pass. You don't need to give the reason as to why you are not medically able to drive. You just need to have confirmation that you have had your license declined on medical grounds. And I have heard in some circumstances via the vocational rehab services that if you don't have access to public transport, you don't live near any, you're medically unable to drive, and you have to be able to get to work, that they have been able to set up taxi services for some people. Hidden disability awareness cards, lanyards, the sunflower lanyards can be really helpful for people to have an idea that you might find some things a bit more difficult. If you don't want to have things on show all the time, you could just use them every now and then, going into the bank, for example, showing it to say, I really need to talk to somebody just in a quiet room where there's no distraction, or showing it to, for example, the bus driver. Citizens Advice Bureau, and again, just sort of adjusting the lifestyle as you need to. So really just, the conclusion is, the management of a lot of overlooked symptoms will be a combination between health professionals, therapists, specialists out there, and yourselves. Listen to the advice you're given, and ask for and accept help. People say, do you want me to do anything? They really want to help, so accept it if it's offered. Use what works for you. What works for one person won't necessarily work for somebody else. So it might be a little bit of trial and error, and everybody is different. And I just think, remember, unexpected things can happen to all of us, and we all need some help in working out the best way to manage them. We all need time to adjust, and the first solution might not always be the right one. Thank you.
Thank you so much, Lesley. That was, I think, for so many people, so practical and informative. And I can tell from the number of participants we have how much this resonates, because this is the talk that's had the second highest number of people join today. So it's clearly something that is speaking to people. So thank you. What we're going to do now is hear from Sarah, who's going to give a case study putting into practice what Lesley's talked about. And then we're going to come back to both Lesley and Sarah, because I know there's going to be lots of questions. So thank you so much, Lesley. So Sarah, I'm just going to put the spotlight on you.
Thank you. So I'm just going to talk about one of case studies of somebody who we are still currently treating. Who suffered with a Cavernoma. So this is Julie. So Julie was initially diagnosed with a stroke in July 2021. It was during the time when kind of COVID was still around, and after being on the acute stroke unit for around 11 days, she was then discharged home. She continued then to have further readmissions over the year, as she was gradually deteriorating, and then in 2022, at the beginning of 2022, they diagnosed her with Cavernoma, and she had surgery for this. Following her surgery, she was discharged back to a nursing home, and where she required full 24-hour care. So she had 2-to-1 nursing staff for all personal care needs, positional changes, assistance with things like eating, drinking as well. And she was basically, her and her family were told that this would be predicted to be the case for the rest of her life. So her husband contacted us and asked us to come out and do an assessment. She was unable to communicate effectively. So basic yes, no answers, very intermittent with her, awareness, not particularly recognising much, and was also extremely hypersensitive. Had lots of joint and muscle stiffness because she'd not been moving, and fatigue was a massive issue too. So this was Julie when we kind of first started seeing her. So following assessment, our initial aims for helping Julie and initial kind of goals were to help reduce the sensitivity. So every time Julie was kind of experienced touch, even if it was light touch, it was extremely uncomfortable for her. So we worked towards trying to reduce some of that sensitivity. And also worked with family on trying to kind of gain that, continuous approach between our therapy sessions to help reduce some of the hypersensitivity, in particular along the right side of her body. We also worked quite a bit with the nursing staff to provide assistance with things like positioning changes and providing advice and support. And also at the time when it started to, we were kind of starting to work more on sitting out in a chair, we were kind of giving advice and education on the positioning in the chair as well, and also things like in terms of hours, starting off gradually, again thinking about fatigue, and then gradually building it up to either a morning or an afternoon session. The other issue that we found with Julie is that her right side in particular was weaker than the left, and definitely a lot more sensitive, but also a range of movement was extremely restricted. So another aim was to try and improve the range of movement in both upper and lower limbs, in order to improve that flexibility. And then we also, as she progressed from there, we started to work on her sitting balance a little bit more. So here are a few slides for Julie. So initially on the top left, we're looking at the passive range of movement, and working on trying to improve the range around the hip and the knee, which was extremely restricted on the right side. And then the second in the middle, there is a wheelchair where we're looking on posture and sitting alignment, but this would only be done in therapy at the beginning. And then on the right hand side, family got a loan chair to help provide that little bit more assistance and positioning, which Julie ended up using every day, and built up to being able to use it for at least the morning or the afternoon. So it's a lot more supportive than your general chair, and it also can be reclined or inclined. So it also gave Julie that experience of, again, when she was tired, it could be reclined so she could have a period of rest. And then when things like meals, eating, she's in the most optimum position for things like that. So I think main treatment techniques used, lots of hands-on therapy in order to improve the range of movement, muscle joint range, and advice education on things like positioning, posture and care management. Aquatic therapy, which we started doing, which was great for Julie. And then as she started to progress, looking at things like functional task practice, so putting all the movement and the working on her trying to be able to activate muscles more functionally once she was able to access this. Quite a bit of hands-on massage as well to again for helping with the joint and muscle range. And then some also exercises and education with both Julie and the family, again, as she could start to take on a little bit more as she started to progress more. So I've just got a video here, Julie's initial sessions-ish in the pool. So I'll just play this for you. Oh, sorry. So obviously within that, we're looking at automatic movement, which we were starting to tap in with Julie, but also the warmth and the buoyancy of the water, the freedom of the water for her to explore more movement. And, you know, Julie really responded well, or still responds well to hydrotherapy. Oh, I don't know. That's it. So, yeah, so as Julie started to progress more, we progressed to goals and aims. So with physiotherapy, we tend to set short-term goals with a long-term aim in mind. So the next aims of treatment was to work more on a unsupported sitting balance, sit to stand, stand to sit, standing transfers using a standing aid to start with, and then progress to using a walking aid. Lie to sit, sit to lie, and stepping practice, obviously then as we were getting more independent, and then stair practice eventually. We also kind of, again, as much as possible, trying to incorporate some of these movements into more function, like brushing teeth, washing face. And then when she was at hydrotherapy, she was actively involved in being able to shower as well. So again, on the left, we're looking at unsupported sitting balance and working on her alignment a bit more. Again, just looking at this, I thought this was a really nice picture because Julie's more engaged cognitively. Looking at pictures, I think it is related to family on this picture. So she was again becoming more engaged cognitively, much more responsive, and fatigue-wise, her fatigue levels were improving quite significantly. And then looking at sit to stand with the MoLift razor on the top right, again for her to be more weight bearing and work on that function. So this is just a quick video of a functional task practice, lie to sit, sit to lie, and incorporating the things that we'd need to educate her on, you know, when she was moving. Trying to promote that independence as much as possible, but then facilitating for the things that she was struggling with at the time. And then there's just from there, this is just another video. I'll just play a short part of it, looking at stair practice. So again, as Julie's looking more towards, we were then planning for home at this stage. But in order to go home, she needed to be able to negotiate the stairs. So this was completed in one of the back corridor in the nursing home. So again, we're really looking at how much that progress has kind of continued through the time. And at this, like I say, at this point, we were preparing for home. Okay. So Julie then progressed to being able to go home. So we did a home visit to check the environment. There was also an occupational therapist who was involved at this stage from the NHS services, who did an assessment too. When Julie was discharged home, she had a profile in bed downstairs, but has recently been able to return upstairs for sleeping. So now she needs a little bit of support with personal care tasks, but is so much more independent with this overall. Able to go up and downstairs now at home, and she's also worked on being able to get in and out of a car. She's able to travel short distances locally, and being able to tolerate this in terms of fatigue levels as well, which is great. She's continuing to have physiotherapy weekly, hydrotherapy fortnightly, and they are also, Julie and her husband is also planning a short holiday, hopefully soon. The long-term aim with Julie has always been, I want to go on a cruise. So and she's always said that since the early stages of her rehabilitation. So I've absolutely no doubt that we will, she will push towards that point. And I think for us, it's been wonderful seeing them changes with Julie, but there's still, we still need to work on quite a bit in order to continue to increase her independence, fitness levels again, which is why we're still continuing with the weekly sessions. So that's Julie now. She doesn't necessarily need this frame in the middle anymore when she's at home. And then I guess in summary, from what our services can do, or what neurological physiotherapy can do, yes, it's the hands-on side of things, it's the strengthening side of things, it's looking at exploring active and functional movement, working on mobility, working on balance, working on upper limb rehab if you've got upper limb weakness, but it's also educating family members, other carers, care staff, working with other members of the MDT is really important as well. And at the end of the day, everybody is individual. We have to tailor a bespoke package of care or treatment according to what the client to work towards, and it's about working on short-term goals to work towards the bigger picture and the long-term aims.
Thank
Any
you
questions?
so much.
Thank you.
Fantastic. And if you could just stop screen sharing, that'd be amazing. I love the end about going on a cruise, and just the practical difference you've made. So I know many of you, when we talk to you on the helpline, you're not always getting the neurophysio that you need, or it can be delayed or not long enough. And I think, so what you've done is highlighted how you may be told that actually your options are limited, but there can be opportunities out there and you can see such a difference. And I think this is where, if you are a partner or family member and you may feel a little bit helpless, what can I do? One of the best things you can do is be an advocate for the person who is unwell with a cavernoma. Speak up for them. Ask about what are the other people that you could be referred onto to help with things like neurophysio. So Sarah, Lesley, I'm just going to open up to questions now. So if you would both mind turning on your video and your audio, that would be amazing. And I'm just going to see if there are any questions from anybody in the chat. So I'm just going to give you all a few minutes if anybody would like to ask a question. I think one to you both is, it's not uncommon that we hear on the helpline people say they've been told there just isn't the follow-up in terms of neurophysio. What can you do in those cases?
I think it's difficult, isn't it? Because I think, if there isn't that follow-up, or I think at the moment, from the information that I'm getting from people that are coming to our services, that they've been discharged after a couple of sessions on the NHS, or there's a long waiting list, or it's they're not necessarily being able to access any services. I think, and again, I guess it's very difficult, isn't it? Because obviously we're a private service, so in order to be able to access the service, there's you need to we do have to charge. So I think first of all, it's making, being aware that there are the private services out there that may be able to provide some form of treatment and rehabilitation. And I think maybe if the statutory services aren't necessarily able to offer what you need, maybe looking at trying to, see what private services are out there to help support you. That would be my first thing. But then I guess that doesn't really answer the question about, in terms of it's affordability as well, isn't it? Which is always tricky.
Absolutely, and it is. We know there are pressures within the NHS, and ideally, it would be the case that it can be offered through the NHS. And if you can't afford private, that's tricky. Just one thing I'll share, and then Lesley, it'd be great to bring you in as well. Sometimes we find an organisation called PALS can be really helpful. So if you're in a hospital, and it's not uncommon, we have people who are waiting longer than they should, and actually it may be the case there is the neurophysio available to them, but there's a bit of a delay, and we know it's really important to get that timely. PALS are there to help you raise a concern if you've got one, and to be a voice for you to help you access services that you're entitled to. So they can also be a champion for you if you feel that your voice isn't heard. And we're mindful our clinicians in the NHS are always working so exceptionally hard, but there can be pressures. Lesley, do you want to come in there as someone working within the NHS? What can people do if they're struggling to access this follow-up support?
I think, like you say, if people are currently inpatients, then the PAL services are really helpful. They can obviously sometimes access, teams or services that, or raise concerns on behalf of people who maybe don't feel able, or, don't know who to raise the concern with themselves. Yes, I think, anybody in the NHS would like to be able to deliver more care than they perhaps can. There are, limited resources. But yeah, PALS, I think if you're inpatient hospital, you speak to, the doctors in charge of your care, the therapists who are, sort of available on the ward, or the nurses in charge, explain the concerns. And then, looking at, getting advice about the next steps and what the rehabilitation services are, where are the units that would be available, or what's available in the community. I think some of the difficulty is that, community services are so different area to area. And, Southampton covers a big regional area, and we're no different to anywhere else, that we have hundreds of different rehabilitation teams in the community within our region, and trying to keep track of who can provide what in what areas. So I think, as well as sometimes it's useful speaking to the local services, to the local therapists, therapists that are linked to the GP surgeries, but also the local charities as well. So, some areas have charities, some of the stroke associations, Headways, things like that, who are very sort of specific to certain areas, have a bit more of an idea about what might be going on in their own specific area with services.
And Lesley, that's such a great tip, because, for example, Headway, CAUK, because we're a rare condition, we're UK-wide. Headway, for example, has local branches who are really knowledgeable about what's going on in your particular area. And that can be very good to work out what's actually on offer in your local area. So what could you be asking for? And it can be really hard to sometimes speak up and to say, actually, I need more. And I've heard that there could be more. But we'd encourage you to do that, because you are the priority, and everybody, that's really important. So I'm just going to ask two questions, or actually one question, then I'm going to, but I've just seen something pop up in the chat, which is lovely. And it says, "Hi all, it's Julie here." So that's Julie from the case study. A great day of very informative presentations. Getting physio in very early helped me to recover to the point I could leave the nursing home and go home. The cruise is getting closer every day, and my thanks to all for enabling this goal. Oh, that's lovely. Julie, I'm so glad you could join us. And thank you so much for sharing that, because I know some people joining today's conference may be early on in their journey of recovery from a hemorrhagic stroke, and hearing things like that gives people hope. So I'm going to do one more question, and then we're going to close for today. And that's a question for Lesley. So this person says, "I've been told that I need to see a functional neurological doctor. Do you have an FND doctor in Southampton, as I'm only about 45 minutes away from you?"
Yes, we have, most of our neurologists will cover that. We have others, I can't tell you exactly which one it is, but I know we have at least one, if not two, that sort of subspecialise and are quite interested. So yes, definitely the neurologists in Southampton will cover that. Depends whereabouts you live, because the neurologists in Southampton are sort of based with us, but they go out and cover all the areas in our region and do satellite clinics as well. So different consultants will cover, for example, Dorset or the Isle of Wight or Basingstoke or wherever. And so you may well be referred to your local hospital to see a specialist neurologist who is also linked with the neuro unit in Southampton, but they do satellite clinics to save you driving 45 minutes when you could see the same person locally.
And that was something which Professor Rustam Al-Shahi talked about as well, is that care in the community, those satellite opportunities are so important. And I'm just going to squeeze one quick question in, actually. It just popped in just before we finish. And there's two for you both. So this CAEK member has left side limb ataxia, and that has occurred following brainstem surgery. And they've had some improvements over 3 years, and neurophysiotherapy has helped, but they're wondering, is there anything else that could help speed up their improvement?
I think I don't know, with the neurophysio, it just broke up a little bit then. Helen, was it ataxia?
Yes, I'll just read the question. So they have left side limb ataxia following brainstem surgery.
Yeah. So I don't know if the physio may have discussed something like a lycra garments, so they can sometimes help kind of calm some of that ataxia or ataxic movements down. That's always a one that we would consider. I think ongoing, neurophysio, repetition and frequency can always help make them changes, quicker. So maybe a short blast of intensive treatment might help improve symptoms even further. So yeah, that would be my suggestion.
Thank you, Sarah. And do you want to just say that name again for those who might have missed it, about the garment that can be worn?
So it's a lycra garment. So I think if you speak to your physiotherapist about it, so it's like a tight skin. One way of trying it out, first of all, would be what we tend to say to some of our clients is it's like a compression sleeve. So sometimes you can get things like compression sleeves for like cyclists or runners on places like Amazon, just to give you a bit of an idea as to whether that helps calm some of that ataxic movement down a bit. So the idea behind the compression is it provides a bit more sensory feedback, and sometimes it can calm some of that unwanted movement. So yeah, maybe that would be one way of doing it. Go down the route of maybe trying like a compression garment, but maybe speak to your physiotherapist. So it's lycra garments.
Oh, thank you. I love the fact when I come to these conferences, I'm learning. I didn't know about that before, so that's really helpful. So Sarah, Lesley, thank you so much.